Okay, welcome back. We will get started with the second part of this afternoon's session. So I'm going to pass over to Judi first and then pass on to Jeff after that, and then we'll have some more time for some Q&A. So Judi, I'll pass straight over.
Great, thank you very much. Hi everybody. So we thought it would be helpful to include in our group of talks just a reflection really on how a systems approach fits into the MRC NIHR relatively new guidance on developing and evaluating complex interventions. This guidance came out when TRUUD was already up and running in 2021, and I guess some of this talk is me reflecting where I'm coming from. You've heard that TRUUD is quite a multidisciplinary consortium. My background is as a public health academic, where I've worked a lot on different approaches to intervention, development and evaluation. So this was sort of a useful, I guess there's a lot of ongoing conversation in the public health world and the public health research world about how systems thinking fits in with kind of these more traditional ways of thinking about things that we perhaps have all had. So yeah, so I mean, I won't go through the guidance in loads of detail. I'm sure lots of you, if not all of you, will be familiar with it, depending on what your backgrounds are. But this is where it's published if you want to have a look at it for yourselves. So it's published in the BMJ. But this is basically, in a nutshell, what the guidance is kind of saying in terms of what we need to think about when we think about evaluating complex interventions. So some of this is just a feed through from the guidance that previously existed. So we still have the basic idea that you have feasibility studies. Well, you develop your intervention, you have a feasibility study, you have a sort of full evaluation of what you're doing, and then you might have an implementation phase where you see how your intervention might work kind of in the real world and might be scaled up. What's newer in this new guidance is that that process doesn't have to be linear, so you can sort of start at different points in that process. You might kind of go back on yourselves a few times before you kind of finish the work that you're doing. And a couple of other things that are newer, I think the idea that we might not always be developing our own interventions, that we might actually be evaluating other people's interventions. So the new framework sort of allows for that scenario as well. I think more and more as academics, happily, we're partnering with people in practice a lot more and evaluating things that are already ongoing. And then the other really key thing to pull out is those core elements in the middle. So the suggestion that whatever approach we're taking to our evaluations, we need to consider these different things. So we need to think about the context, and I'll be talking about that a lot because I think that's where we particularly think about systems really. But we need to have a programme theory that we're constantly refining and retesting. We need to engage with a wide range of relevant stakeholders. We need to work out what our key uncertainties are. There's a lot of refinement that goes into not only developing the intervention in the first place, but when we use what we find from our evaluations, that often leads to further refinement, and also economic considerations. So what I'll do, so as I say, I won't sort of go further through the guidance as such, but what I'll try and do is pull out what the guidance specifically says about systems and sort of try and reflect a little bit about how we can take that forwards in evaluations. So a key thing that they say is that complex intervention research can take an efficacy, effectiveness, theory-based and/or systems perspective. So I guess, as I say, what they're really trying to do is present this guidance as a framework which doesn't preclude particular kind of approaches or particular disciplines that people are comfortable with. So the idea that, you know, it could still work for a slightly more traditional kind of perhaps randomized controlled trial design where we're trying to measure the effectiveness of something, but that it also very much can allow for taking a more systems perspective. And actually I'll say a bit more about my view, I suppose, on whether those two things actually are in as much opposition as I think sometimes people think that they are. The guidance then also pulls out quite a few reasons why it's really important to think about systems, or why a systems perspective can be really helpful when it comes to evaluating public health interventions. And I noticed Nick's on the call, Nick Cavell. So this I'm not going to talk about this map at all, but this is just an example of a map that I found really helpful because it's in my area of research normally. So looking at Oh, Nick's just hashtagged himself. Yeah, so it's a very good map for people that work in the area of young people's mental health. So done in collaboration with the Health Foundation, and I think it's a really good illustration of how it can be used for these different reasons, really. So I think what the guidance notes, really, or I've summarised what the guidance notes. So whenever we think about health outcomes and inequities, which are obviously the two major concerns of public health interventions, we always think about kind of what the wider determinants are. So it's not just young people's mental health, but all health outcomes really have very important wider non-health determinants. And it's sort of the bread and butter really of public health research, that we're trying to get to those wider determinants, and we're trying to intervene early to make a difference to those wider determinants. So it absolutely makes sense that as part of that, you kind of need to understand what that wider context or system is. And also, just reading the chat, and also the fact that, you know, those determinants don't operate in isolation, so they all interact with each other. You know, we all live in kind of complex environments with a multitude of different things that impact on our lives, and you know, yeah, and that kind of compound outcomes that we experience. The other thing, actually, just to say about inequities as well, is that often, you know, the difference, I guess, between the idea of an inequity and inequality is that inequities are unfair and they're preventable, and they are basically socially patterned. So the causes of inequities in health are actually part of those wider determinants. They're part of that wider system. So really important, if we want to tackle health inequities, that we really take into account that context. And also the fact that in public health research, we are intervening in real world complex and changing contexts. So even though we've all had a really good go at sort of trying to apply the RCT model to public health interventions, actually it's really difficult to do that because we're working in environments that are changing all the time. We're not working in laboratories where we can control everything. And the final sort of point really is that disrupting the system can be much more effective than just kind of bringing in a fairly localised, discrete intervention. It's much more kind of helpful, I think, to think about how can we change that whole system, and think about interventions that we do as events in systems, rather than something that's somehow sort of isolated from the context that it's happening in. But I did want to sort of make the point that I'm probably still already switching a bit between context and systems, because in some ways I don't think this is as new as we sometimes think. I think we've been aware for a while, in the previous version of the MRC guidance certainly talked a lot about the importance of context and why that's so important when it comes to what we're trying to do. So, and I'm just bringing in an example here from the one RCT that I was actually the principal investigator on. Very proud of it, but we actually did not find that what we were trying to do was effective, which is the reason I'm bringing it in as an example here. So what we were doing was intervening in a school setting. We were bringing in improved support and training for teachers' mental health. And what we found, long and the short of it, we published this paper as part of it, which drew on a lot of our process evaluation data that we collected, and what we were arguing there is, by taking a systems approach, it helped us understand why the intervention hadn't been effective, and it was basically because you needed a bigger change across the whole system to be able to make that difference to teachers' mental health. So it wasn't just, not that providing extra support and training couldn't be helpful, but that needed to happen in a context where you're also addressing some of those root causes of why teachers have poor mental health in the first place. So you need that change to happen across the system, which is exactly what a quote from our participants says there. So they were actually ahead of the game by using systems terms themselves when we were talking to them. So, I mean, I guess that leads on to sort of reflect that, and this is a point again in the guidance, that what a systems approach can encourage us to do is ask different questions potentially. So a key question really is about the way the system might affect the way the intervention happens, but equally the intervention might change the system, the sort of thing, picking up on what Neil was talking about. One intervention might actually have kind of ripples across a much wider part of the system than we perhaps have allowed for. So by taking a sort of systems approach, it encourages us to think about that. And that's what I mean about the sort of questions we might be asking really. And some people have argued that we should be using different terminology from a systems perspective. So we might want to think about changes and impacts rather than outcomes and effectiveness. personally, I'm not so sure that that's the point. I think a systems approach can still pick up on whether something's effective or not, but it just helps us ask additional questions really about why that is and what it is that's happened in the system. So we can think about sort of individual level change still, we can think about impacts on individual health outcomes, but we can also think about how the system itself has changed. So yeah, this is just, again, a bit more reflection on how those questions and the things that we can measure from a systems point of view might fit into what we perhaps think of as a more traditional approach to public health intervention evaluations. So I think a good public health evaluation would already have included a process evaluation, and actually a systems perspective can answer a lot of those sort of questions we're trying to get at in our process evaluations really. So it can tell us, as I sort of showed with my study in schools, it can show us why an intervention had the effect or not that we were wanting it to have. It can also importantly help us notice where unintended effects might be happening, and again that's picking up on what Neil was talking about, where you might have effects somewhere else on the system that you perhaps weren't expecting. Sometimes that might be a good thing, sometimes that might not be such a good thing, and I think those feedback loops really help understand how, if you've made a change in one way, that might have an impact somewhere else that you need to kind of bear in mind. It can also tell us a lot about how the changes might impact on inequalities. I think it also answers important questions about sustainability, because again, I think an argument about taking that systems perspective and looking at whether you've changed the system, certainly what we're hoping in TRUUD is that what we're doing is changing kind of processes and the way things happen across the system and join up across the system, which would be a much more sustainable change than just changing things that happen with individuals. And I think it also answers a key question about transferability and where what you're doing might work in other places. So I think, again, by sort of understanding that wider system, you can start to think about that. And there's just some examples there on that slide as well about how the sort of outcomes that we might look at in terms of system level changes can lead to new policies. They could be about where there's been changes in culture, or they could be about how a new practice might become normalised across the system. And Neil's already talked to us about systems mapping, which is obviously kind of one activity that you can do that he illustrated really well in terms of taking a systems approach. And the guidance does sort of talk about systems mapping, in particular the MRC guidance. So these are some of the things that I pulled out from the guidance, and I think from what other people have said as well about why systems mapping and when it can be helpful as part of your public health evaluation, even if you're not taking a kind of full-on systems approach. I think if you do it at the beginning, it can help support your development of a programme theory about understanding what you're trying to say. I know that sort of the more traditional thing that people have constructed are perhaps logic models, but I think a systems map in a way can be a form of a logic model, or a logic model could pick up on parts of the systems map and kind of go into it in a bit more detail. But I think by mapping that whole system out, it helps you understand, if you do something, if you do A, why will that have an impact on B? It can help identify priorities to focus on, which I think is very much one of the ways that we used our systems maps in TRUUD so far. And it highlights gaps in knowledge as well, perhaps where we don't know so much about how different bits of the system impact on each other. And I think it can also identify data sources. So by mapping out kind of what the areas of the system are and who the actors might be, that might tell us where we need to collect data from, who we need to have as our participants, or what areas of the system we need to investigate further. And I think, as I've already talked about, really, crucially, it identifies how the context or other factors in the system might facilitate or prevent change, which is really important when you're thinking about interventions, so that you understand how what you're doing, or how the context might impact what you're doing. And I think, perhaps thinking more, moving from research into kind of practice and policy making, I think just that big picture thinking, which isn't new to policymakers either, but that idea of really thinking through who are our stakeholders, what are the wider determinants that we're thinking about in our public health interventions, can really sort of help a strategic response, both in terms of what interventions we're doing, but also what the implications are from our findings and what we want to go on and recommend. So the last thing I was going to say really is just to draw attention to another piece of guidance, which again, you know, might be that this is really familiar to everybody already. This actually came out before the MRC guidance on intervention evaluation more broadly. This is specifically from the NIHR School of Public Health Research, looking at developing a systems perspective specifically for evaluating public health interventions. And I think it's really helpful because I think what it hopefully does is kind of, again, it's quite inclusive. I think it can draw people in and equip people to start thinking about systems without feeling they have to do something as clever and fancy as what Neil is able to do. So there's sort of these different stages, I guess, that they talk about in terms of how we might approach including a systems perspective on what we do. And at the very sort of smallest end, it's about just systems thinking. It is just that work that you do around kind of what is the context, what are the wider determinants, how do things link together, and how will that impact on our intervention, and how can our intervention impact on that. So I think that almost feels like the minimum really we should all be doing. Perhaps we don't all call it systems thinking, but I think that, you know, that is kind of key to any public health intervention evaluation. And then beyond that, we've got systems mapping, which we've talked about a little bit, and then more complicated computational modelling and innovating new approaches. But I think, you know, that the message probably is that I think it's so important now to think about systems, whether you call it context, whether you call it systems thinking. And I think, you know, even if you sort of come from a very traditional public health evaluation space where, you know, that MRC guidance is going to be very key and is kind of looked to by everybody, I think that can still incorporate this kind of very important systems way of looking at things. Thank you. I think it's over to Jeff now.
Cheers, Judi. Thanks. I'll put my slides up so I can just actually